politics ko is just a small window, whether I run for president or not. But it is dependent on the word of honor that I gave to Romandes. Pag tumakbo siya, count me out. But I will support him because I promised him. Para lang ma-break yung impasse noon. So, yun ang formula namin. Hindi ninyo alam yan. Hindi ko rin sinasabi sa, if you maybe bong, because we were in the room, and I was talking to him in whisper. Atras ko.
Newsday continues here on One News Now. I'm Charles Lejano. The Health Department insists that hospitals in the metro are now at a low-risk position, but some facilities are still reaching full capacity as COVID-19 cases climb in their LGUs. Camille Samonte with the story.
Metro Manila has come a long way since COVID-19 cases peaked early this year. Daily cases dropped after the implementation of stricter lockdown measures, and hospitals have now reached the low-risk category. The Health Department reports utilization rate of ICUs and critical care beds has decreased to around 50%. But despite this positive development, some areas in NCR are still classified as high risk. These include Makati and Muntinlupa.
Sa data tracker po natin, mapapansin naman talaga natin na bumababa talagang number of new cases. Meron nga lang talagang cities, sinabi ko kasi kanina, yung Muntinlupa at saka Makati, medyo nasa critical risk or high risk position. Pero collectively ho, sa buong NCR, in number of ICU beds, both for public and private, bababa naman po ang utilization 50%. Low risk category talaga ang kabuuan collectively for Metro Manila.
At the hospital ng Muntinlupa, the ICU and emergency room have reached full capacity. According to its director, Dr. Edwin D. Matatak, the facility only has a few beds available to begin with. This is the reason why it's easily filled with new patients, including those from the nearby LGUs.
Medyo nag-i-increase pero too early to say na talagang nagsisurge ulit. Relatively sa ICU and sabi ko nga ICU and COVID floor, mas marami talaga ever since ang ICU. So isipin, mas nauna niyang na-reach yung 100% utilization ng ICU.
Di Matatak said they noticed an increase in admission of COVID-19 patients when quarantine restrictions started easing in the NCR Plus bubble. When the ECQ was implemented back in April, around 50 to 60 COVID patients were admitted in the facility. This rose to around 80 patients over the past weeks. Utilization rate of their ICU beds also climbed from 6 to 12. Di Matatak says Ospital ng Muntinlupa can still accept patients as long as there's still space. But he warns the public not to be complacent.
Merong nakaamba na surge. May nakaamba. Oo. So, siyempre, ayoko naman sabihin, punta lang kayo dito. Oo. Hindi, ready. Totoo naman yung ready. May nakaamba, so mag-iingat, no? Kasi nga medyo patas. Ako, aminado ako doon. From 60, nagiging 80. From 6, nagiging, ang ICU, nagiging 12.
The City Health Office of Muntinlupa also admits that the cases in the city have started to increase. Around 40 new cases have been reported in the city in the span of 2 weeks.
Yung gathering of people, so bumabalik na naman yung mga request na magkaroon sila ng like meeting or gathering. So doon kami nagkakaroon ng problem. It's not an issue of yung the restrictions in the people na talagang gusto nilang to move around, no? Yung magkaroon ng gathering.
The LGU urges establishments allowed to reopen to strictly implement health protocols. Currently, the active cases in Muntinlupa stands at 425. The LGU has also started inoculations for the A5 priority group. For News 5, Camille Samonte, we are One News.
Outside Metro Manila, hospitals in areas that are experiencing a surge in cases are struggling to accommodate the rising number of patients. One of these LGUs is Cagayan de Oro. Chema Vanseño with the story.
The Northern Mindanao Medical Center now implements an appointment-based system for outpatients as COVID-19 cases surge in Cagayan de Oro. They are limiting the number of non-COVID patients to focus on the bigger task at hand. Non-COVID outpatients admit the struggle is real with the new protocol.
Maraming requirements. May QR code, may certification pa dapat galing sa barangay. Hassle talaga. Kung di ka dumating sa oras ng appointment mo, di ka talaga makakapasok.
NMMC Director Dr. Jose Chan says they are also increasing COVID beds for critical cases to address the rising number of patients. He adds that hiring of additional personnel may not be far off.
We have to increase it to 50%, even more than that. So we add up more critical beds for these cases.
The city recorded more than 120 new cases. Death toll climbed to almost 400. City health officials suspect the surge has something to do with mass gatherings and travel outside Cagayan de Oro.
Based on their profiles, no, pamilya ang affected, workplace, kabarkada, na-attend ng mga gatherings like weddings, birthdays, yung mga wakes or funerals.
Cagayan de Oro City Mayor Oscar Moreno defends National Task Force Chief Implementer Carlito Galvez. Galvez recently earned the ire of Cagayan de Oro Congressman Rufus Rodriguez over supposed poor vaccine allocation for the city. Moreno says there are also allocated Pfizer vaccines for Cagayan de Oro.
Congressman Rufus was ill-informed and ill-advised. Yung paninira niya kay Secretary Galvez was totally inappropriate.
Pfizer vaccines were used in inoculating members of the city's A4 population on Wednesday. Authorities are targeting to vaccinate at least 400 people per day. But restrictions remain stringent. Barangay exit passes will now be imposed to limit movement. Checkpoints are also still in place with Cagayan de Oro's MECQ status extended until June 30. For News 5, Jem Avancenia, we are One News.
The Interior Department takes over a town in North Cotabato as all its officials have been placed under isolation. All LGU officials of Magpet, North Cotabato are currently isolated due to possible COVID-19 infection after being in close contact with 2 colleagues who contracted the virus. Due to this unique circumstance, DILG Region 12 Regional Director Josephine Cabrido Leysa has been designated by the agency as the municipality's caretaker. Interior Secretary Ed Año directed Leysa to be the caretaker of the LGU until he has designated all of the officials or when their leave of absences are over. But the directive emphasizes that Leysa cannot perform regular duties, functions, and the powers of the local chief executive. Leysa is only tasked to oversee and ensure the delivery of basic services in Magpet and to approve disbursements. Another 1.5 million doses of Sinovac have arrived at the NAIA Terminal 2 earlier today. Vaccine czar Carlito Galvez Jr. and Health Secretary Francisco Duque III welcomed the shipment that landed in the country at 7:23 a.m. This includes the 500,000 shots procured by the Filipino-Chinese Chambers of Commerce and Industry, with the remaining ordered by the government. With the arrival of more Sinovac shots today, the country now has 9 million doses of the Chinese vaccine brand. Meanwhile, the Quezon City government has launched the so-called QC Bakuna Nights to inoculate workers after working hours. The program aims to expand the reach of the city and immunize workers whose only free time is in the evening. Around 2,000 pre-registered frontline workers were inoculated during the first night of the initiative at the Quezon City Hall grounds. The Health Department says there are certain exemptions when it comes to wearing face shields as safety precautions against COVID-19. Speaking with 1PH's Sa Totoo Lang, Health Undersecretary Maria Rosario Vergeres said that exemptions include those doing strenuous activities at work or those working out. Individuals riding active transport like cyclists and motorcycle riders also do not need to wear face shields.
Doon po sa joint memo circular namin, may mga exemptions tayo na-identify. Balikan po natin ang objective ng face shield. No? This prevents yung droplet na mag-land sa face mo. So kung wala naman pong maraming masyadong tao, like you're outside also, you don't need to wear that face shield.
For Octa's Guido David, wearing face shields in public places and indoors is still necessary to avoid transmission. But in some cases, David says that people can forego the requirement.
Sa pampubliko, I think required pa rin yung face shield. Pero yung outdoors, naglalakad lang. It was my understanding din, hindi naman siya required kasi marami akong nakikita outdoors na walang face shield eh. So, pero kung sa indoors, I think, pwede naman sigurong kailanganin yan. Base sa data na tinitingnan, may research silang pinagbasihan na nakatulong naman daw yan sa indoors.
Veteran voice actress Inka Magnayi continues to defend Liza Soberano for her performance as the voice behind Alexandra Trece. In an interview with 1PH's Sa Totoo Lang, Magnayi insisted that Soberano's voice was perfect for the role of the Filipina babaylan mandirigma. But she admitted that Liza's voice acting could still be improved.
Given na since this is Liza's first ever voice acting gig, there will be points of improvement, of course. But what I meant na when I said na her voice is perfect for the character, bagay na bagay yung sound ng boses niya sa itsura ng character na si Munting Trece.
On her TikTok account, Magnayi also posted her version of Trece's voice. Who do you think did it better? Let's watch this.
Magandang gabi, Captain Guerrero.
Kumusta, Alexandra? Salamat at nakapunta ka rito. Malakas ka ang kutob kung gusto mo nga itong makita.
Aaminin ko, napaisip ako nung sinabi niya yung nangyari dito.
Kung ganon, siya ba
ang White Lady ng Balete Drive? Lumang kasulatan, pabayaang gawa. Malinaw na sinakripisyo siya. Mas importanteng tanong, sino ang papatay sa multo at bakit?
And those are the top stories at this hour. Join us again later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.